I'm going to talk about a few things. First, I'm going to talk about concussion and what it is, and then talk a little bit about second impact syndrome, and then finally, chronic traumatic encephalopathy. That third issue has been in the news a lot, and I'll refer to some professional players that have been diagnosed with that disease. But it all starts actually as early as middle school age, and so that's why I'm here to talk to you about it. So first, let's talk about concussion and what it is. It's an impairment resulting from head trauma. So it's a very general term, and often a subjective term. Often the player, him or herself, is the only one that is able to report that they have an concussion. In other words, if they hear a ringing in their ears, or if they have a terrible headache, that constitutes a concussion because you've got an impairment of some sort. Although you as the coach may not see that objectively. You know, how many fingers do I have up? They might be able to name that. On the flip side of that, the student athlete might not actually perceive that they have a concussion, but you're seeing them walk to the side of the field, you know, staggering. And so on both ends, either way could be a concussion. And so concussion is very general. It has a lot of manifestations. There was one young man I was listening to who said that he became very emotional. He was hit hard in a practice, actually, and he just started crying, and he didn't know. He was a very stoic young man, and he just started crying, and he didn't quite know why. So there's parts of your brain that have, you know, some to do with emotion, some to do with sound, some to do with sight, you know, and whatever happens to get bruised at that moment would manifest in that impairment. But what are some of the most common findings we see in concussion? And this is from a study in 2004, and the most common one is a headache. So again, that's something that the athlete will have to report, right? Because you can't get into their minds and find out that they have a headache. And that can be difficult because if an athlete wants to get back on the field, he might just say no, or she might say no, I feel fine, but I really have a headache. So that makes that's obviously a very difficult situation. But other things that are very common are a feeling of being slowed down, difficulty concentrating, dizziness, a fogginess. Sometimes a patient will describe themselves as being foggy. They'll have fatigue. Visual blurring is relatively common. Sensitivity to light, memory dysfunction, and balance problems. So as you can see, a lot of those are subjective to the athlete themselves, making it a little bit difficult. So you have to really encourage your teams to, you know, report these things and not think they can just cowboy up and just get back out there. So any questions on what a concussion is or isn't? Okay, so the bottom line is you don't have to be knocked out to have a concussion. I mean, that's I think the common misconception is, you know, unless you're knocked out, it's not a concussion. That's not true. It's some impairment. What is post-concussion syndrome? This speaks to what Rick was talking about in terms of the days after the hit. You know, the brain is basically repairing itself at that point, as you would a bruise on your arm. And basically, during this period of time, these several days after the hit, the athlete will have decreased processing speed, mental processing speed. They might have some short-term memory impairment, concentration difficulties. They might have some emotional problems, irritability, depression. They might have sleep disturbance, which would result in fatigue. Again, this general feeling of fogginess could persist for several days. And all these findings can result in academic difficulties. So this is what happens in the days anywhere up to 10 days or so post-concussion. Now, there's also this phenomenon of subconcussive hits too, and so and repetitive subconcussive hits might have some damage to the brain as well. But of course, those would, you know, there's not much you can do about it because those can be neither perceived by the player nor the coach, and so that's why we tend to focus on concussion. But we try to encourage people to have as few subconcussive blows to the head as possible, as well. And one big way you could do that is to, in the case of football, for example, would be to have as few contact practices as possible. So what's happening to the brain that's being concussed? And this is a picture that you might want to keep in mind. Your brain is actually floating inside your skull. It's not sitting there like a bowl of Jell-O, but rather it's being floating in this cerebrospinal fluid. And so if you move quickly back and forth, that brain is going to slosh back and forth within the skull and hit the inside of the skull back and forth. So you've all heard of shaken baby syndrome. Those babies can be killed actually without any impact onto a wall or a floor or anything like that. Simply the act of shaking that child will kill the child because the brain is being banged back and forth within the skull. Well, a similar phenomenon occurs in the setting of a hit on the field, the soccer field or lacrosse field. And so if you keep that in mind, it kind of gives you a visual way of thinking about what's going on in the head. And again, I keep going back to football, but I don't want to point the finger only at football. It happens most often in football, that's true, but in several sports, wrestling, lacrosse, soccer as well. But so the football coaches don't feel offended. I'm just focusing on that because it's certainly something to be considered in all sports, probably with the exception of the chess club or maybe golf. But here's an example of what's happening. The brain moves forward in the skull. The frontal lobes will hit the inside of the skull. That's where you get your contusion. And then it will rebound because it's sort of a jelly. It's sort of like the consistency of Jell-O, actually, the brain is. It'll hit back on the other side, and then you'll get what they call a contre-coup injury. So you've got the injury up here and back here because it sloshed backward. So that's a linear deceleration, acceleration, deceleration. And then you can also have rotational injuries, but basically it's the same phenomenon where you get it sloshing one way and then the other way. And depending on what you happen to hit, what part of the brain would result in the particular neurologic impairment you might have. So here's some microscopic slides of what can happen when you have this shearing effect. Now, just to remind you from your biology classes you took long ago, here's a neuron sitting here, and it has a long axon coming out to it so it can communicate with other neurons. Well, when that brain sloshes back and forth, that neuron will get sheared. Okay? And the arrows there are actually pointing to those sheared axons, because there's flow within the cell within that axon, and that when that gets blocked, there's basically a traffic jam of proteins, and that sphere is that traffic jam of proteins at the point at which you've got the shearing of the axon. The good news is that this is repairable. So, and we have a special stain we can use to pick up on those spheres. So this is an example of diffuse axonal injury from someone who got, I don't know whether it's a motor vehicle accident or what the injury was, but it was a trauma that resulted in this shearing of the axons. But they can repair themselves. And so what I just showed you was an autopsy picture. But in testing on high school football players, on live players, the University of Illinois did do a study on several high school players. And they had these guys had impact sensors on their helmets throughout the season. And on average, they sustained more than 800 blows to the head, each of which were at least 15 Gs. So they had more than that, which are less than 15 G-forces. But a somewhat significant hit would be considered 15 Gs. And on average, they were hitting the head 800 times during the course of a season. And one student actually received 2,235 hits to the head of that force during the season. 15 Gs probably won't give you a concussion. Concussion range is more like 35 Gs or so. But just to give you an idea of, the number of hits that one is getting, and you can imagine how much you can decrease it if you minimize that in practice, at least. And interestingly, high school players appear to require a longer recovery time than older individuals. when directly compared to collegiate and professional athletes, high school athletes exhibit longer symptom recovery following sport concussion. And that, to me, makes sense because their brains are more metabolically active, they're growing, they're sprouting new axons, and so therefore there's more demand. And so you injure it, and it's going to take longer for the brain to get back to where it was. Unlike all the rest of us, our brains are decaying as we sit here. These young men and women, their brains are they're actually making connections between their neurons. So that's concussion from sort of a clinical and a anatomic point of view. Any questions? That's the first of my 3 parts here. So second impact syndrome. This occurs when an athlete sustains an initial head injury and then suffers a second head injury before the symptoms associated with the first impact have cleared. And so this is where you come in, is you can pull that athlete out before that second impact occurs. The second blow may actually be quite minor, and it might even be, for example, a blow to the chest that indirectly jostles that brain, because remember, that's floating, right? So you hit someone in the chest, their head's still going to go back and forth a little bit. And it might not take much, especially if you have some swelling in the brain, to cause more injury in the brain. The affected athlete may appear stunned, but usually does not experience loss of consciousness and often completes the play on that second impact. But then in a few minutes later, the athlete who is conscious collapses to the ground, semi-comatose, with rapidly dilating pupils, loss of eye movement, and respiratory failure. The vast majority of second impact syndrome cases in the literature involve athletes under the age of 18. So basically what you're having is you get a little bit of swelling in the brain, you get another small impact as little as 15 Gs, and then it's just swollen enough, and now you've got a dead student on the field. And this happens every year in sports. And as I said here, it's probably caused by swelling within the skull, causing this herniation. And when you herniate, what I mean is the brain kind of has to expand somewhere, so it goes downward on the breathing centers, and then you die. So here's an example. This is a true life example. A 16-year-old high school football player sustained a helmet-to-helmet collision during practice. So again, this is something during practice that, again, could theoretically have been avoided by minimizing the full contact practices. By the way, the University of Illinois did look at the winning records of the teams that eliminated their full contact practices, and they were no different before and after elimination of those no contact practices. But anyway, this 16-year-old was briefly unconscious, but the incident was not reported to medical personnel. He complained of a severe headache, but played 2 days later. After making and receiving several tackles, he walked off the field and promptly collapsed into a coma. A CAT scan of the head at the hospital showed brain swelling, and the boy was declared brain dead the following day. So he never woke up. So that's second impact syndrome is something you have to be quite aware of, and it's the main reason why one of the principal reasons why you're pulling that student out of the game if they've sustained concussion, or even something you think might be a concussion. I would err on the side of pulling the student, if you're not sure, or maybe they're not quite being honest with you because they want to get back in the game. You might err on the side of bringing them to the sideline, and they'll appreciate it in the end too, because they'll be ultimately get back in the sport earlier if they're taken care of earlier. So any questions on second impact syndrome? All right. So the last topic is chronic traumatic encephalopathy, and that's sort of the end stage of what happens when you get all these multiple hits. And again, these have been reported in, this condition is reported in many sports, mostly in football, and part of that, of course, too, is that there's a lot of research going on in football players, too. There's been a focus on that. The NFL has funded this research and has got behind it, which I admire. And a good friend of mine, Ann McKee, is head of the NFL Brain Bank, and she gets a lot of these NFL players after they pass, and then she examines their brain and makes this diagnosis. But it's been seen in other sports as well. So what is it? It's a progressive neurologic disorder found in people who have suffered some kind of brain trauma. So it's not something you see right during the season, or even the next season, but it comes a few years later. It's kind of a cascade effect. You cause the damage, and then over time, that the biochemical processes that you've set in motion have now cascaded to a point where you've got some serious problems. Many of the same, these individuals may have many of the same symptoms of Alzheimer's, but they get it a lot earlier. They get it in their 50s and their 40s. And it can begin with behavioral and personality changes, followed by disinhibition and irritability. Disinhibition, by that I mean inappropriate behaviors, risky behaviors that a normal upstanding citizen wouldn't take, you know. And it can appear later in life because it takes a long time for that initial trauma to give rise to this nerve cell breakdown and death. And this is a picture, a silver stain of a brain, and that what you see here on the left side, actually I can show you with the cursor probably, yeah. This thing here, this is a tangle. So this is a neuron here, and there's a tangle in here. And what happens is with these chronic traumatic encephalopathy or CTE cases is their brains get filled up with these tangles. Those neurons do not work. And so if your neurons don't work, you get demented. Or you have psychiatric problems, or both, which is usually the circumstance with these CTE patients. Now this is the case that I actually got a little emotional when I first read about it, because I grew up in Massachusetts, was a New England Patriots fan, and I remember that 1986 Super Bowl. And so I remember Dave Duerson, and he, as a former Chicago Bears player, he killed himself this past February with a gunshot wound to the chest. And in his suicide note, he said, quote, "Please see that my brain is given to the NFL brain bank." And sure enough, those tangles, those things I showed you here under the microscope, they were shown all over his brain. And he knew there was something wrong. And this is a guy in his 50s. He knew he was having, his wife was reporting that he had memory problems, but in addition, he had a lot of emotional problems. And this was a successful guy. He had Duerson Foods, which he was posing in front of there, but it was just too much for him, the emotional stuff. And then got it from his memory problems. And this was all accounted for by the multiple hits he took throughout the season. Now you might say, well, what does this have to do with my middle school student? I mean, they're not going to go to the NFL. Well, let's get a little younger here. Chris Henry, he's a 26-year-old. He played for the Cincinnati Bengals, and he died after falling from a moving pickup truck during a fight with his fiancée. So that kind of behavior, that would be an example probably of what we call dysexecutive function. In other words, your frontal lobes aren't controlling your behavior, and so, he was kind of acting crazy and resulting in his death. And most likely he was acting crazy because of the CTE. And sure enough, at autopsy, his brain showed many of these tangles, which I'm depicting here. And this is actually Chris Henry's brain. This is an actual picture of his brain under the microscope. So if I've not convinced you yet, well, we can go even younger. This individual is only 20 years old, played for the University of Pennsylvania football team. So Ivy League, so he probably wasn't that great a player. It wasn't like he was, Big Ten or whatever. But so you could conceivably have players of this type in your own programs. He had no previous history of depression, but he ended up hanging himself in an off-campus apartment following an uncharacteristic emotional collapse. And sure enough, his brain was sent to Boston to the brain bank there. Sure enough, CTE, those tangles were also present. So as I go younger, you see these things, this cascading effect, the injury is caused quite early, and it's thought to really happen in middle school and high school, where most of these players started, and then cascades further and further. And he only got to his junior year in college before it took him. And then the question then arises, why do some athletes get CT and some do not? It depends to some degree on the position you play, and then also on genetics, as does any environmental impact. So, my grandfather smoked a lot, and he died without lung cancer. He smoked several packs a day, died without lung cancer. And yet other people, smoke one pack a week and get lung cancer. Well, you're talking about the genetic predisposition that might make you susceptible to the carcinogens in smoking. Similarly, there's a genetic predisposition toward getting the CTE. And also, actually, there's evidence to show that there's genetic predisposition toward sustaining concussion and how long it takes you to recover from that same concussion. Unfortunately, right now, the genetics they're still under research, so we can't really do genetic testing pre-season and say, gee, you've got a bad genetic profile, you better not play this particular sport. So really, we have to just be aware of everyone. I actually got myself tested for that gene, and luckily don't have that gene that predisposes you to chronic traumatic encephalopathy, prolonged concussion recovery, and also Alzheimer's disease. There seems to be a connection between these two, Alzheimer's disease and CTE. And I've showed you a little bit what the brain looks like what a brain with CTE looks like, but I'll show you a few more pictures. The CTE brain, we stain for those tangles I was telling you about, that brown stuff. That's a normal control, same age. And so these are real findings. This isn't something that's just sort of like theorized. Here's a kind of a resting photograph. On your left is a 65-year-old normal person, part of the brain called the amygdala, which has a lot to do with memory formation. A 45-year-old NFL player, I'm not sure of the circumstances of his death, but you see his brain is kind of ragged, and it's filled with these tangles. And of course, boxing, this phenomenon has been recognized in boxing since the turn of the century. I mean, it was first described in 1905 and called dementia pugilistica. But now the name has been changed to CTE because there are a lot of other sports in which it's seen. But boxing would probably be the most extreme example of that, because they get the most hits, and the whole point of it is to actually induce a concussion in the opponent. Here's another case. This is an individual who died at the age of 45 after 9 years in the NFL. Depression, poor decision-making, substance abuse problems, which ultimately led to the individual's death. And again, you see all these tangles in their brain in various parts. A lot of these have to do with memory. And the amygdala, as I said, short-term memory also has the hippocampus has something to do with emotion as well. So it accounts for the psychiatric issues these patients have. This is the brain of John Grimsley, who is a linebacker for the Houston Oilers, again, 45. And he had these tangles. I won't get into what the protein is itself, but the point is, the normal control, a 65-year-old should have a nice clean brain like that. This 45-year-old who had not really, taken care of the multiple hits he was getting and the concussions, it ultimately cascaded into this. And again, the box are even worse. And this is to illustrate the sort of the anatomic, microscopic substrate to what we're seeing in these teenagers. Is these things, these little spots where these tangles are developing. Now, this individual died at the age of 18 just by accident. It was unrelated to football or anything. It was just a motor vehicle accident. He was not drunk or anything, but he happened to be a football player, and they did autopsy him, and you could see this cascade already beginning at the age of 18. He had no mental problems, he had no psychiatric problems, no neurologic problems, but we can see the beginning of that cascade right here at 18 years old. And we can surmise that that cascade began a few years before that, and perhaps even as early as middle school age. So what can we do to prevent CTE and second impact syndrome is basically manage concussions better. There's not too much you can do about the subconcussive blows because neither you nor the player can appreciate them. But at least we can deal with the concussions. And as Rick mentioned, Governor Quinn did sign a bill that addresses this issue, and I know he's trying to get something passed by the Board of Education to institute the policy that would be consistent with Governor Quinn's bill. But Illinois is certainly not, in the lead in this. We're probably, the 25th state to have done this. It's not like big government, is coming down on us. This is pretty much, this is probably going to be federal law before too long. I spoke to someone in Washington, D.C. a couple weeks back, and they said it's only a matter of time before this becomes a federal law, where coaches need to be educated, parents need to be educated about about this phenomenon, or these phenomena. So, and when we're dealing with these students, we have to think of them as both students and athletes. And so, when in doubt, the phrase is, the bumper sticker phrase is, when in doubt, sit them out. And so, when in doubt, if you're not sure they had a concussion, or maybe they got a little dazed, or maybe he has a headache, he's faking it, sit him out if you're in doubt. But that's true not only on the field, but in the classroom. So what you want to try to do is develop school system supports and restrict their cognitive exertion while they're recovering in the 10 days or so after the concussion. And then they can get clearance to return to the game of the classroom as well as the game on the field. So, as Rick alluded to, if a student, for example, sustains a concussion and he has to study for a history test that week, if you're not the teacher, maybe you want to have a discussion with the teacher about putting that test off, because these kids need to rest. They need to rest their brains, because mental exertion is going to make those axons more difficult for them to heal up. And so I think Rick's trying to put that into the District 186 policy too. I don't know how it's all going to play out, but that's certainly the recommendation of the experts, is to make sure they get academic rest or cognitive rest, as well as rest from the field. I should mention that it's not just academics too. Video games would be another thing in which there's sort of mental exertion there. They should be discouraged from doing that, and really just kind of chill out for a few days as best they can. So in conclusion, I've discussed what a concussion is. And as you can see, the definition is incredibly broad, which makes it kind of difficult. What a second impact syndrome is, and that is actually a deadly risk. And then finally, CTE, which I know you've heard about in the newspapers of late. So thank you, and I think that through this knowledge and awareness and skill in recognizing will result in early identification and recognition of concussions, which will allow for complete and individualized management, ultimately resulting in decreased risk and improved outcomes for these kids, so that we don't have kids developing Alzheimer's disease at the age of 45. So I appreciate your time, and if you have any questions, please bring them on.